The doctor is in, and today is pediatrician Dr. Courtney Sauls from Ascension St. John Pediatric and Adolescent Medicine. Today, we are talking about that dreaded childhood disease, pink eye.
Pink eye.
Pink eye. Dr. Sauls, welcome.
Thank you.
Not all, I mean, this can affect adults too, right? But
Sure.
you see it a lot in kids. Why is that?
Yeah, it's super contagious. So pink eye is like inflammation of the top layer of the eye, lots of drainage, lots of redness to the eye, maybe painful or itchy, very contagious just by touching. And so that's why we see it commonly in like daycare centers and young children that are in close contact with each other.
And it's probably really common to reinfect yourself, especially if kids maybe have contacts already or something too, right?
Exactly. It's going to be found on their hands, even their little loveys they sleep with, surfaces they commonly touch. So that's why it's really contagious in daycares. They're just those grimy hands, those germ centers for those little ones. So really, really contagious.
What causes pink eye?
Yeah, so typically it's a virus. I think that might be surprising for our viewers to know, but viruses most commonly sometimes can be bacteria, sometimes can be allergies as well, even a chemical contact like we see it in the summer a lot with swimming. But with viruses, you'll also see some nose congestion, some coughing as well, runny nose. That's when you kind of know it's a virus. It's usually more a bacteria if it's kind of just the eyes by itself, constant eye drainage, that kind of thing.
And you mentioned a second ago about babies. Some parents may think that their infant may have pink eye, but it may not be, right?
Exactly. I see that a lot in my clinic. Newborn babies have really tiny tear ducts on the inner corners of their eyes, and so that might cause them to have a little bit of yellow discharge at times, maybe wake up with their eyes matted shut, and that's usually not an infection, thankfully, for those new babies. So use a wet washcloth and wipe away that goop. For the little tiny babies where it's not an infection, they can massage the inner corner of the eye with their pinky finger, but those warm compresses, using some artificial tears to loosen up that goop, that's really what you can do at home.
Yeah. Should you go get a prescription for this? I had it a couple years ago, and you can tell it's kind of gets crusty and gross and stuff. But should you get a prescription, or does it go away on its own?
Yeah, that's going to be on everyone's mind. The daycare centers will probably want you to have a prescription, but that may not be the case. Most of these infections will go away in 5 to 6 days on their own. But a good kind of rule of thumb, if you might need a prescription, is if it's constant drainage from those eyes, worsening redness where the upper and lower lids are swelling shut, your child can't open their eye, or if they're having a lot of pain with it and can't move their eyeballs, that could be really concerning, where I'd want you to come see me in the clinic and we might get you some help.
So they can just come in and see you, and if it's causing issues.
Absolutely. Anytime, even if you're just worried, come on and see me.
Yeah. All right, Dr. Sauls, thank you so much. Good to
You're
see
welcome.
you. If you have a question for today's doctor or any of the doctors that we have here on the Noon Show, email them to us at noonshow@griffin.news or go to our Facebook page and send us a message.